how I distinguish the specialization of pure medical dermatology is it's a pretty all-encompassing term. Essentially, that's anything in dermatology that's not surgical related, which is fairly limited, especially in surgical dermatology. So I think medical dermatology involves any angle we're dealing with infectious diseases in the skin to chronic inflammatory disorders of the skin. Classic one would be eczema or psoriasis, to cancerous disorders of the skin such as cutaneous T-cell lymphoma, which would be less surgical and more medically treated, to immunologically based disorders ranging from cutaneous lupus, and then anything that's related to internal medicine that has cutaneous or skin manifestations. And there's a lot of disorders that patients will come in with us that have a cutaneous disorder that they might not even be here for. For instance, a very uncommon disorder is a condition called osteogenesis imperfecta, which is a different patterns of bone abnormalities where they have essentially brittle bones. I have a patient comes in for something unrelated to that at all, but one of the cutaneous manifestations of that disorder is they have blue sclera. So their eyes are blue. So whenever you see someone with blue sclera, which is extremely uncommon, someone that knows what the disorder is, some dermatologist, most should know what that is, could identify that patient coming in and go, oh, do you have osteogenesis imperfecta? So that would be kind of the medical side where you see an internal disorder that has skin or cutaneous manifestations. There are situations where that's important because patients might come to us with a cutaneous eruption or cutaneous problem, which would be a medical dermatologic issue that the dermatologist can actually make a diagnosis of something going on internally that could be a significant benefit for the patient's health.